If you can achieve the same thing with an $80 wearable, it's a lot better for the American people.
As the co-chair of the Digital Health Caucus, along with my friend and colleague, Representative Kelly, I believe digital tools can play a huge role in improving the health of Americans. Secretary Kennedy, do you agree that consumers should continue to have access to these tools?
Absolutely. In fact, we're about to launch one of the biggest advertising campaigns in HHS history to encourage Americans to use wearables. They can see, as you know, what food is doing to their glucose levels, their heart rates, and a number of other metrics as they eat it. I've personally had friends who've utterly changed their lives just from wearing a glucose meter. And they've lost weight, they've lost their diabetes, diagnoses, and you see this happen again and again. It really has a miraculous impact on health in our country. And it's $80 a month, and we're exploring ways of making sure that that those costs can be paid for. The Ozempic is costing $1,300 a month. If you can achieve the same thing with an $80 wearable, it's a lot better for the American people. And for people who can't travel, for elderly Americans who can't leave their homes, but they can find out what's happening to their health without going to see a doctor or to go to an urgent care or an emergency room.